Namaste and welcome to 4 Directions of Wellness. I'm Roberta Diswood. As we enter cold and flu season, it is always important to educate ourselves about the symptoms of these seasonal illnesses, the difference between them, and how to prevent or lessen the sickness. Our guest today is Lieutenant Melindy Caboni. Melindy is a public health nurse at Northern Navajo Medical Center. Thank you, Melindy, for being here. Go ahead and introduce yourself.
Hello, my name is Melindy Caboni, Tachini Nishle, Kintlachini Bushashchin, Totachini Dashache, Totachini Dashanella. I am a public health nurse. I have worked for 12 years here at Northern Navajo Medical Center. I worked at the pediatric outpatient clinic for 4 years and in public health nursing for 8 years. I have been a nurse for 25 years.
Well, thank you for being here. Well, here we are, another winter of cold and flu season. To start, tell us what causes colds and flu.
Cold and flu season occurs in the fall and winter. Most flu activity occurs between December and February. Cold and flu are caused by different types of viruses. The virus infects the upper respiratory tract, which includes the nose, nasal cavity, mouth, throat, and sometimes the lungs. The virus spreads through the air by tiny droplets made when people cough, sneeze, or talk. The droplets can also land in the mouths or noses of people who are nearby. Sometimes a person may get infected by touching a surface or object that has droplets on it and then touching their mouth, nose, or eyes. The objects, for example, can be doorknobs, phones, or utensils.
Okay. Cold and flu can also be very similar, but how are they different?
Colds and flu share many symptoms. It is difficult to tell the difference between the two. A test can determine if a person is sick with flu. Colds and flus are caused by different viruses. Cold symptoms are usually milder than flu. People with colds are more likely to have a runny nose or stuffy nose.
So if someone believes they have the flu, what should they do?
Most people do not need medical care or treatment. If you are sick, stay home and away from others to prevent spreading the flu. Go to the emergency room if you begin having difficulty breathing, shortness of breath, chest pain, worsening cough, or weakness. If a child has the flu and their temperature is more than 104, they should go to the emergency room. If you feel very sick, get help right away. People who are at risk for experiencing severe illnesses are children younger than 5 years old, people 65 and older, pregnant people, and people that have certain medical conditions.
So when can people return to normal activities like school or work?
You can return to normal activities when symptoms are getting better and you have no fever and not using fever-reducing medicine for 24 hours.
Okay, and now let's talk about how to prevent getting the flu.
One of the best ways to prevent flu is to get a yearly flu vaccine. Flu vaccines are available for 6 months and older. Other things you can do are stay away from sick people, cover coughs and sneezes, and wash your hands to prevent spreading germs.
So we don't want to end the show without mentioning COVID and RSV. Both of these are viruses that are circulating. What should we do about COVID and RSV?
Both are respiratory viruses similar to flu and can lead to hospitalization for people who are at higher risk, such as older adults and those with certain medical conditions. Everyone 6 months and older can get an updated COVID vaccine. CDC recommends adults 60 and older can get an RSV vaccine, but they need to talk with their provider.
Well, thank you, Melindy, for being here today. This has been 4 Directions of Wellness. We'll go on it.